My name is Benjamin.
And I'm Julia. This summer, we worked in Professor Loes' lab under the mentorship of Juan de Loes. Our project addresses the heterogeneity of mental illnesses. Multiple diagnoses share overlapping symptoms. For example, two individuals who are both diagnosed with bipolar disorder may have different presentations, but one of them may share several symptoms with someone diagnosed instead with schizophrenia. A recent focus in psychiatry research is dimensional models rather than traditional categories. With these models, finding homogeneous patient groups may aid us in the search for biomarkers. For our project, we used over 40,000 intake notes from a database of Colombian psychiatric electronic health records. Notes from the mental status exam and patient history were pre-processed to extract concepts. This table is an example showing the count of concepts in each note.
In this figure, you can see how frequency of certain concepts varies by diagnosis. We explore how these concepts may be useful for making categorizations within and between diagnoses. Our approach was to use Latent Dirichlet Allocation, a generative statistical model, to take bag of words representations of the patient notes and group them into abstract topics. For each topic, we get the words or concepts associated most heavily with it. We also get a representation of each note as a percentage of each of the newly defined topics. For example, here you can see that patient note 0 is represented 75% by topic 9. We were then able to visualize each note in a lower dimensional space with t-SNE. This is an LDA model based on first notes of patients with 1,000 of each of the 3 mood and psychotic disorders: schizophrenia, bipolar affective disorder, and major depressive disorder. We balanced these diagnoses to address the class imbalance of our data. We chose the number of topics based on a topic coherence metric. In this t-SNE, each point represents a note, and they are clustered based on topic weights.
We can also color each note by characteristics such as patient age, sex, and diagnosis. We can note, for instance, how there's a male-heavy area of the model here in blue, where we also see a lot more schizophrenia patients in red. Green corresponds to bipolar and blue to depression as well. Since the t-SNE shows us clusters based on topic weights, we see that the topic seems related to a diagnosis. These associations signify that these topics may hold significance and therefore could even be clinically useful. We want to, however, identify this relationship between topics and diagnosis more quantitatively. This figure shows how some diagnoses load heavily on certain topics. We see that topic 0 is related to depression and bipolar, and topics 1 and 9 are associated with schizophrenia. We can see how concepts like sad, normal memory, coherent might be more associated with depression, and alert, missing introspection, and abnormal abstraction with schizophrenia. We then performed a regression on these topic weights and used it to generate predictions for schizophrenia on the x-axis and major depressive disorder on the y-axis for each note, and then denoted the ground truth diagnosis with color.
Based on these calculated predictions, we were able to create ROC curves for each diagnosis. Based on the AUC, we identified that our model and regression has predictive capabilities for schizophrenia and major depressive disorder. The regression's inability to predict bipolar affective disorder may be representative of the challenges associated with diagnosing and identifying bipolar disorder. Through our LDA and analysis, we were able to identify meaningful categorization of mental health disorders with the potential for predictive capabilities. These results could eventually be used to provide a basis for more individualized treatments and potential groupings for future GWAS studies within and across diagnostic boundaries. The hope is that it will ultimately help improve patient outcomes. We'd like to thank our PI, Professor Loes, and graduate student mentor, Juan de Loes, for this opportunity. They were instrumental in helping us understand our project. We'd also like to thank the Big Summer Program and the NIH for funding us.
Thank you.